What's up, guys? It is Dr. I and Dr. J, the twin doctors, and we are back.
We're back. So it's insane. I'm sure most of you guys are some long-term BDO viewers, so you know who we are. But we used to do monthly question and answer sessions on BDO. We'd go down to their downtown Chicago office, and every month we would have communion with you guys. And people would basically just send us questions.
Yep.
We would read the questions on air and answer the questions. And we loved doing that because it gave us an opportunity to connect with not only viewers, but viewers like us who were dealing with health issues like us, who had the health concerns that we had. And then life happened and we kind of dropped off for a while, although we've been really busy, and we'll tell you guys all about that. But we were recently going through old videos because, you know, we're coming back to BDO and we wanted to start to promote it, and we wanted to make sure that our website was up to date. And we realized it had been 8 years.
He says 8 years. I feel like it hasn't been that long. I feel like it's been more like 6, maybe 7 years.
It has been 8 years. We were last doing BDO Facebook Lives in 2018.
So 7 years. But do you know what he said? He said, I was looking back at the old videos and we looked all young and fresh. And I'm like, well, why are you saying that? Because I still look young and fresh. So I took it personally.
We look old and worn out.
And haggard. Anyway, so I'm going to be looking down at the phone from time to time because my eyes are horrible because I am not young and fresh. So I can't see the questions there, but I'm still with you guys. I'm just looking at the questions here. So this is what we do. We're going to sit here. We're going to talk. We're going to talk about really anything and everything, but we're here to answer your questions. So you have questions about anything. People think, oh, they're OBGYN, so I've got to ask women's health questions. You definitely can, but you can ask questions about anything. Women's health, men's health, children's health, mental health.
Because one thing that people may not realize is OBGYNs, obviously we do obstetrics, we do gynecology, but we're also the primary healthcare providers for a lot of women. And so we do a lot of primary care as well. And actually the American College of OBGYN a couple of years ago actually made a move so that we would be recognized both as a surgical subspecialty, because OBGYNs are surgical subspecialties, but also that we'd be recognized as primary care docs. So while we're waiting for questions, I actually want to tell people, because some people may not know much about us, so I'll tell you guys who we are and what we're up to. So first of all, we're the twin doctors. The sign says it right there.
It says it right there on the sign. Like we are the only twin doctors. None other exists anywhere. It's just
literally
us.
We're an anomaly. Dr. J, Dr. I, Jamil Abdurrahman, Idris Abdurrahman. We're twin doctors. We're based out of Chicago, Illinois.
Well, you know what? Let's be honest. So we grew up in Chicago. Yeah. We're in the northern suburbs now. So I still claim Chicago, close enough, Chicago adjacent, but you know, like 45 minutes away. Yeah. I digress. Continue.
Yeah. So we're OBGYNs. We've got a couple of offices in the Chicagoland area, and oddly enough, we've got an office in St. Croix in the U.S. Virgin Islands.
Nothing odd about that. I'm tired of the Chicago winters, and I enjoy the sun.
Exactly. Wintertime, it is a beautiful getaway. But one reason we actually went there was, again, it gave us an opportunity to work with patients who looked like us. They don't necessarily sound like us. They talk kind of weird.
They got a little bit of accent, like a little mixture of like a Jamaican accent, like a Trinidadian accent or something.
Yeah. They don't necessarily talk like us, but they look like us, and they have a lot of the same issues that we have. So we've got those 3 offices. In addition to being full-time docs, we do a little bit of television as well.
I think we're over full-time docs. Yeah. Like full-time is 8 hours a day. I'm like double full-time, 16, 17, 18. Not that I'm complaining. I'm just saying.
Sounds like complaining to me. But we're also, we do a little bit of TV. So again, some folks may not know. So the first time we were actually ever on TV was...
We're not going to mention that. We're going
to mention. There's a couple of things I will talk about openly that he hates to think about. But one thing is we did The Amazing Race.
I don't hate to think about it. It was just painful, man. It was so painful.
We'll tell you why it was painful. But we did The Amazing Race, which comes on CBS. And that was something we had always wanted to do. And we signed up for it. We figured there's no way we're going to get on it. And sure enough,
we got a question. I'm going to let you get back to your little boring story in a second. Don't listen to him about The Amazing Race. Okay, so Lynn McMillan is asking, what's good for a ganglion cyst? All right, so this is the thing. So this is one of those things that's actually easy enough to treat at home. Anybody can treat a ganglion cyst.
Tell people what it is first.
So, okay, a ganglion cyst is a collection of fluid, tends to be on tendons. A lot of times you're going to see it like on the hands or wrist. And what's the treatment for it, Dr. J?
Well, so he's trying to put me on the spot. But before we talk about the treatment, I just wanted to say one thing. Because I want to break it down for people. Like, I want them to know every little thing about every little thing. What are tendons? Tendons are the little things that connect. No, honestly, they connect muscles to bones, right? So when you move your fingers, it's because there's tendons that connect the muscles in your arm to the fingers, and then you flex. So that's what tendons are. So
Dr. J is having a moment right now with tendons. If you see his finger, he recently broke his finger and tore a tendon.
I'll tell you about that.
He's a little bit sore about tendons.
Yeah. I got an issue with tendons.
That's what tendons are. All right.
So a ganglion cyst is a cyst or fluid collection, like Dr. I said, that develops on tendons. Normally tendons in the wrist area, the arm, but really can
And the reason that I was asking Dr. J, and the reason that I love the treatment for ganglion cysts, and the reason I said that anybody can do it, literally, it's funny, when I was either med student or resident, I don't know, but my attending said, do you know how to treat a ganglion cyst? And I said, no. He got a big book and it was like, you just smash it. You just smash it. And that is literally what you do with ganglion cysts. You just basically break them. Now, yeah, I wouldn't necessarily recommend doing it at home.
I was about to say.
You can.
Dr.
I wouldn't recommend doing it. I know,
Dr.
I wouldn't recommend doing it at home, but literally, it's literally just pressure on the cyst. That is how you treat it.
Yeah. Now, if you don't necessarily want to smash your tendons and ligaments and bones and muscles with books, like Dr. I said, you can also see a doctor. They'll normally just numb the area, so they'll give you a little bit of local anesthesia, and sometimes they'll apply pressure, or they'll make a little incision and they'll drain it. But basically, it's like a cyst you get anywhere. Fluid-filled collection, you just want to drain it. It's like draining a balloon, popping a balloon, goes away.
Not the slightest bit dangerous. Can be uncomfortable, but not the slightest bit dangerous. So see your doctor. Very easy to treat. Can be done in the office. Easy peasy.
Yeah. Now,
Kristen's laughing. Why are you laughing at us, Kristen? She's laughing about the book, I guess. All right, go ahead. Continue your story, Dr. J.
So I'll finish telling you about the Amazing Race, but with my finger, this is how I know I'm getting old. I was traveling back, and we've been traveling back and forth a lot, and because we got the office in St. Croix, and I was actually out in California a couple of weeks ago for just getting my medical license out there. Long story. Anyway, I was pushing the bag under the seat in front of me. And I do think that this was God trying to teach me a lesson, because I was able to board early, and there's this little shared area between the two seats. And I'm like, I'm getting on first. I'm putting my bag there. That way I don't have to go to the overhead bin. I can get to my computer, blah, blah, blah. Got there. I was first. I was very happy. I'm pushing my bag under there. It's not quite fitting. I'm like, by God, this bag won't make this fit. So I jammed it, and I pushed so hard, I just heard something pop. Heard it pop before I felt it. Pulled my finger back, and it was just dangling. Turns out I broke a bone, ruptured a tendon, had to get a couple of pins put in the finger. They've been in for like 4 or 5 weeks now. I have another 4 or 5 weeks. It's actually a pain in the butt, though, because you don't realize how much you bend your fingers, because the pins are in there. This isn't
about you, doctor. This isn't about you.
I know, whatever.
The moral of the story is check your luggage. Check your luggage.
Check your luggage. Yeah.
We got a question.
You work for the airlines. Check your luggage.
I know.
Pay that $30 fee.
You mentioned Cody Drees at checkout. Okay, so we've got another question for you. Okay, it says, is there anything I can do for PCOS? It's affecting my skin, weight gain, etc. Okay, so first of all, I know Dr. J is going to do this. So I'm going to preempt him. What is PCOS? PCOS stands for polycystic ovarian syndrome. And I'm going to tell you, as a physician and as a women's health physician, I think it is probably one of the most underdiagnosed conditions.
Yeah.
And that's because it's a spectrum, right? And so people feel like if you don't have the full spectrum of PCOS, you don't have PCOS. So this is a condition where you have these tiny little cysts on the ovaries. That's the OS, ovarian syndrome, or I guess the PC, polycystic ovarian syndrome. That's the PC. But you have these tiny little cysts on the ovaries, not usually big enough to cause pain. But what happens is you have a hormonal imbalance, okay? And so because of the hormonal imbalance, you can have what they call hirsutism, where you have hair growth on the face or on the chest, or maybe hair loss, like male pattern balding. You tend to have irregular cycles because you're not ovulating regularly every month, which can cause fertility issues. But one of the biggest things that people don't necessarily talk about with PCOS is the other chronic medical conditions that you have a higher risk for. So insulin resistance, prediabetes, diabetes, high cholesterol, hypertension, heart disease, all of those things. Okay, so is there anything I can do for my PCOS? So it's kind of a chicken or the egg thing, right? But the heavier you are, the more recalcitrant, the harder to treat your PCOS is. Weight loss helps big time, but sometimes it's hard to lose weight when you have PCOS.
Yeah.
And so what you need to do, go to your doctor, ask for labs. You want these specific labs. I'm gonna give you 5 seconds to get a pen. 5, 4, 3, 2, 1. You want to get,
count,
I know, what can I do? You want to get one called LH, one called FSH, and it's particularly the ratio between those two that's important. You want them to
because
check.
Normally your LH, so LH and FSH are hormones produced by your pituitary gland, and they vary depending on where you are in your cycle. But normally, no matter where you are in the cycle, their numbers will be basically the same.
Right.
So if your LH is 4, your FSH should be 4. However, with PCOS,
it's going to be 2 to 1 or more. But a lot of people don't know that. So
when he says 2 to 1, he means you'll have 2 times as
there.
much LH as FSH.
I was going to get there. So tell them check your LH and your FSH in that ratio. If it's 2 to 1 or more, that's an indication of PCOS. Check your insulin levels. Check your hemoglobin A1C. Those are indicative of what's going on with your blood sugar. Check testosterone levels, both free as well as total testosterone levels. Check progesterone. Progesterone is a hormone that you release when you ovulate. Again, because people with PCOS don't necessarily ovulate as regularly, progesterone levels tend to be on the lower side. So what can you do? First thing, get those labs checked, because a lot of times finding what's abnormal will help you to determine what you need to do to treat your PCOS. If the testosterone levels are high, there are a multitude of medications like spironolactone that you can take. There are supplements like Ovasitol that you can take.
And they will lower your testosterone levels.
And then
and when your testosterone levels lower, you tend to ovulate more regularly. And that tends to fix a lot of the issues that you have.
If your insulin or A1C are high, you can diet, exercise, weight loss, right? But medications like metformin, again, the olvasitol, things like that will help. A little known trick, cinnamon, 4,000 milligrams, that will help if you take that every day. So if your insulin or A1C are high, you want to do that. If it's more that your labs are normal, but you're not having a regular period, because that can be unhealthy for the uterus, you may want to just go on birth control pills. So the key really is get those labs that we mentioned checked, and then address each one that is abnormal. You do want to incorporate diet, exercise, and weight loss into the mix. And one thing that people don't always think about, organic. When you're anything you're having, milk, meats, you want it to be organic, because the inorganic things have a lot of hormones, which can also exacerbate the PCOS.
All right, and can I just stop you for 1 second, Dr. Alvo? That was well said. So
Thank you.
You've been hanging around with a smart doctor, I think. But anyway,
I've been hanging with you, Dr.
so
J.
a couple of things he said. The first thing he was saying, check your hemoglobin A1C and check your insulin levels. The reason for that is people with PCOS typically have diabetes or they're pre-diabetic. If your hemoglobin A1C is high, that can tell if you're diabetic or pre-diabetic. And your hemoglobin A1C is a blood test that basically tells us what your average blood sugar has been for the last 90 days. So it's better than checking a spot sugar, because if I'm drinking, this is sugar-free, but if I'm drinking like a soda, you check my blood sugar right afterwards, it's high. Doesn't mean I'm diabetic, right? But if you can check your hemoglobin A1C, it tells you what your average blood sugar has been from the highs to the lows over the last 90 days. Much better indicator of whether or not you're diabetic or pre-diabetic. And a lot of people with PCOS have diabetes or pre-diabetes. And so that's also why the weight loss is important. That's why the exercise is important, because if you bring the insulin levels down, you bring the sugar levels down, just like when you bring the testosterone levels down, PCOS gets better. And one other thing he said that was super interesting was, PCOS is a syndrome. So what is a syndrome? A syndrome, by definition, is a collection of symptoms. And so he said, with PCOS, you tend to have these little cysts on the ovaries. Lots of times you do, sometimes you don't. And that's why
the thing that throws people off.
That's why the PCOS diagnosis is missed so often. And I think it's missed in everybody. It tends to be missed more often in Black women, I think, because people don't always pay attention to what they're saying. And so they'll do an ultrasound, they'll say your ovaries are normal, there's no cysts, you can't have PCOS. Absolutely you can. A syndrome is a collection of symptoms. You may have all of them, you may have 2 of them, you may have 5 of them, right? So important that you realize it's a syndrome. Go ahead.
So I was going to say, we can talk about PCOS forever. We may actually have to do a live strictly on PCOS, because there's so much to say about it, but we got a few more questions.
Okay, can I just say one other thing that was super important? He had said organic. Super important, guys, because not just when it relates to PCOS, but we're talking about PCOS, but this relates to a lot of diseases that we're seeing now. A lot of chemicals that we encounter in our environment, in our foods, are what we call EDCs.
I know he loves his EDCs.
Here man. EDCs, endocrine disrupting chemicals. And endocrine disrupting chemicals disrupt your endocrine system, your hormone system. When you have PCOS, your hormones are out of whack. Sometimes it's because you're exposing yourself to EDCs, pesticides in non-organic fruits and veggies, EDCs. Also, plastics. Avoid using plasticware, plastic cups, plastic spoons, plastic forks, plastic plates. They have EDCs. And here's another one for you. Try and get the carpeting out of your house. EDCs. And non-stick cookware. Don't use it. Easier to clean.
What's that over there, Dr. J?
EDCs.
No, I'm trying to get the attention. All right,
but no, EDCs, but super important. So when you're trying to get rid of PCOS, diet, exercise important, but a lot of people are going to tell you that. Also avoid the EDCs and go all organic.
Okay, so we've got.
Can I just say one other thing before we carry on?
He's going to do it anyway.
Yeah, I got to get it in there every once in a while. We told you guys we were going to catch up with you guys and let you know what we've been doing, but we're getting a lot of questions, so we're not going to spend a lot of time. But like we were saying earlier, we do a little bit of TV. We used to do a show called Moody City Live in Chicago on ABC7. Now we do News Nation every week. We have this weekly session that they call Take Two and Call Us in the Morning. So check us out on News Nation every once in a while. We would love the support, because you know what, at the end of the day, it is so cool, I think, to see Black faces on TV. Yes. And they platform it. So show us some love. Go on News Nation's website, go on our website, give us a like when they show our little segment, give it a like so they know, hey, we like to see Black faces on TV. And the last thing, we're going to be, we have a show coming out soon called Second Opinion with the Twin Doctors. It's filmed here in Chicago. It's going to be on Fox 32, which is the local Fox affiliate in Chicago, but you can go on fox32.com and you can see it everywhere. And it also is going to be on like Apple TV, Hulu, all of the streaming platforms as well. So if you guys could do us a favor, please. It airs September 17th,
yes.
7 p.m. Central. Like I said, you can go to fox32.com, write that down as well. Watch it. Even if you don't watch it, just like it so they think you watch it, right? And support the show.
All right. Can I get to the next question?
Yeah. And then please just like us on our socials too.
Our socials, of course. All right. So I think it's Rita Freeman. Hopefully I'm pronouncing that properly. If I'm not, sorry. She says, I have a belly overhang, stay sweaty, yet I have cracking in skin and powders just beat up.
Gotcha.
What's best to do?
So, anytime you have a skin overhang, basically what ends up happening is you have an area that's moist and you have an area that's dark. And basically that is a
Bacteria breeding ground.
Yeah, I was going to say that's a setup for the overgrowth of bacteria and yeast. Exactly. So you want to do a couple of things. Ideally, you want to keep the area dry. Doing powders can help. Sometimes putting gauze under the area or even clothes that you can kind of tuck in there can help. But you also want to make sure that you're getting rid of the potential inciting fungus and the inciting bacteria. And so you can try using creams that have a combination of two things. One, a steroid. Steroids are just great for cooling down inflammation. When you get that irritation, it's just inflammation. So you want to do a steroid cream like hydrocortisone, 1% over the counter, 2% by prescription, or there's a fantastic prescription steroid cream called clobetasol. And tell your doctor, I don't just want the clobetasol.
The clobetasol with betamethasone.
I was going to say, that too. But those are two steroids. But they actually have clobetasol cream that has antifungals in it as well. Because doctors will give you that steroid cream and you feel better because the inflammation's gone, but the fungus or the bacteria are still there. So tell them you want a combination steroid antifungal cream. And lastly, because bacteria can be playing a role as well, use an antibiotic cream like a triple antibiotic ointment, Neosporin, something along those lines.
And one thing I would also recommend is get your hemoglobin A1C checked if you have not. Because a lot of times I see patients with chronic yeast infections, but not just vaginal yeast infections. They have infections under the breast, under the belly, and it's because their blood sugar is too high. So be sure to get that A1C checked, get a steroid cream, as well as an antifungal cream. All right, so next question. She said Dr. J and Dr. I. I'm going to say Dr. I first. Dr. I and Dr. J.
She got it right.
After recurrent ovarian cyst and uterine fibroids, current age 41, is it recommended to do a total hysterectomy? Okay, so that's what I'm going to tell you, Laura. So I think that like many procedures in this country, and especially procedures in women's health, hysterectomies are probably overperformed. That's not to say that hysterectomies are never indicated, but I think that it's an answer that people go to. I don't mean patients, I mean that doctors go to a little too quickly. So ovarian cysts, it kind of depends on the type of cyst, right? But a lot of times when you're having what they call recurrent cysts, so they keep coming back, those are what they call follicular cysts. Follicular cysts, which means that because every month when you ovulate, you make a cyst. Usually it's tiny, goes away. Sometimes it does not go away. So those are very easy to treat with things that suppress ovulation, birth control pill, patch, shot, things like that. In terms of the fibroids are common. 70-ish, 65, 70% of women have fibroids. So having fibroids does not mean that you have to have a hysterectomy. It's when the fibroids cause issues. If you're having heavy periods, painful periods, bleeding between periods, fertility issues, things of that nature. Even in those cases, hormonal medications will help to ameliorate the symptoms, help to make the symptoms better. There are procedures like uterine artery embolization that you can do that are much less invasive to get rid of fibroids. And what this basically is a simple procedure where they put a little catheter through the femoral artery in your leg, they thread it up to your uterus, they inject a dye, which is the embolization, or not the embolization portion, but they inject a dye. They can see what branches of the major blood vessels go to the fibroids, and they embolize or block those blood vessels. You block the blood supply to the fibroids, you kill them. Then one downside to it is this: fibroids don't oftentimes go away, but they get smaller, they cause less symptoms. But also people who want to preserve their fertility and have kids, it's not a contraindication to getting a uterine artery embolization. But it's not recommended.
It's not recommended because there haven't been many studies that show whether or not there could be poor pregnancy outcomes after uterine artery embolization. And so it's typically something that we could tell people, if you're thinking that you're done having kids, you don't want to do something like a myomectomy where you remove the fibroids and leave the uterus, you don't want to do a hysterectomy where you remove the uterus, then consider it. But it's not something for everybody.
So if you have recurrent ovarian cysts and fibroids, doesn't mean you have to have a hysterectomy. For the cysts, consider hormonal medications to stop the cyst growth and formation. For the fibroids, be it hormonal medications, uterine artery embolization, myomectomy where you take the fibroid out, leave the uterus, hysterectomy, those are all options. So don't run to hysterectomy if they say you need it. But if you've done a lot of things and it's not helping, that may not be a bad answer.
And another option as well is endometrial ablation. You know, endometrial ablation is a literally 2-minute procedure done in the office. Done in the office, no anesthesia. We basically put a little device through the cervix into the uterus. There's a little net on the device that opens, fills the uterus. We hit a button, radio frequency waves run through that little device. In 2 minutes, it basically ablates or kills the lining of the uterus. It's like doing electrolysis for hair follicles. You kill the follicles, the hair doesn't grow. You kill the lining of the uterus doesn't grow. You don't bleed anymore. Fibroids are still there, but if the main symptom of the fibroids for you is that it's causing bleeding issues, the stats say that 60% of women will have complete amenorrhea where their periods stop. I find that if you use
more than that.
I was going to say, if they do a DNC where they scrape the lining of the uterus before they do it, or they give you a medication like Provera for 10 days, which is a pill you take to thin the lining before they do it, 95% of women have complete amenorrhea where the periods stop. And I don't want to go on a detour, but I do want to say one thing. I feel like, and it's Dr. J, or Dr. J, good Lord, I'm Dr. J.
Identity crisis here.
I know. And who am I? Where am I? No. No, I feel that in general, surgery is too often pushed in this country. Not that it's not indicated. In certain cases it is, but especially hysterectomy. And there's a couple of things I would just say to people, and it's caveat emptor, buyer beware. You have people who make their money or the majority of their money off of doing procedures. So they are financially incentivized to promote procedures. Again, I'm not saying that it's not always indicated, but always get a second and third opinion. And also, if you go to teaching institutions, people think that the best hospitals to go to are teaching institutions. To an extent they are, because they get a lot of government funding for research and things of that nature, but they also have the job of teaching residents. And the way we learn how to do the things we do when we're no longer in training is by doing them on people who come while we're in training. And so when you go to these teaching institutions, they oftentimes will promote the more invasive procedures because they're still legitimate treatment approaches, but also it allows them to train their residents. So for all people, but especially patients of color, caveat emptor.
And I just read the rest of that question, then I'll get to the next one. But she said, what would be the downside to it being having a hysterectomy? So it's not that there's a downside per se. I mean, to state the obvious, if you have a hysterectomy, no more babies. So if you want more babies, that's not something you want to consider. But again, hysterectomy, I tell people it's not brain surgery. I'm not that smart. I'm not a neurosurgeon, but it is surgery, right? I'm not. But it's surgery, right? And so there are risks anytime you have surgery. So you have to just be willing to accept those surgical risks. Having said that, there are many people who have a hysterectomy and they're like, it's the best thing I ever did in my life. Yeah. So it's kind of up to your personal preference. If you've done a lot of other things surgically, taken a bunch of medications, it's not working, hysterectomy is definitely an option. Just no more babies after that and be willing to accept the surgical risks and understand them. Yes.
The last thing I was going to say, though, if you do a hysterectomy and it's primarily for the fibroids, leave your ovaries, please.
Absolutely.
I know that you're saying like, well, the ovarian cysts, but if they're reoccurring, like I was about to say Dr. J said again, it's happening, man. Like Dr. I said, when they recur like that, they're typically nothing to worry about. They're functional cysts. They're the cysts that you make with your cycles every month anyway. They can be taken care of with medications, but removing your ovaries basically puts you into early menopause.
Which
not only do you have to go through menopause, hot flashes, difficulty sleeping, decreased sex drive, mood being up and down, vaginal dryness, all of those things, but menopause in general, early menopause in particular, increases your risk for colon cancer, a problem in the Black community, increases your risk for heart disease, Alzheimer's, dementia, diabetes, bone issues. So for the most part, unless you're 48, 49, 50, given that menopause typically hits at 51, consider leaving those ovaries.
Okay, next question. Bobby Blue is asking, how to help with cholesterol? Okay, I'm going to tell you, Bobby, this is one of my favorite questions because while I'm in my early to mid 20s, I actually found, quite by happenstance, I was shocked. Like I checked my labs, like just thinking it was going to be a pat on the back, like you're doing so good, Idris. And my cholesterol was pretty damn high. And so I started doing some more research because, you know, my doctor, I went to my doctor and he prescribed a statin. And I was like, I feel too young to be taking a statin, but also I was like, I feel like I can do it on my own. Yeah. And so there are cases where your cholesterol is high for genetics, right? You just have what they call familial hypercholesterolemia.
Can I interrupt you real quickly? But I'm going to sound like a broken record. When doctors tell you medication, surgery, it's an option, but it's not the only option.
It's not the only
option.
It's
much easier for me as a doctor to say, take this statin.
Exactly.
And adios, versus taking 5 or 10 minutes to sit down and explain things to you.
But we're going to take those 5 or 10 minutes right now. Exactly. So a couple of things. First of all, of course, part of your cholesterol being high is related to diet, potentially. Okay, not saying you per se, just people in general. And so you want to reduce the deep fried, the fatty things in your diet, okay? But there are a lot of supplements that you can take that actually help. We mentioned this earlier. Cinnamon, 4,000 milligrams a day, helps with cholesterol, with blood sugar, also helps with cholesterol. Fish oil, 4,000 milligrams a day. So when your cholesterol is high, it's not just cholesterol, it's the bad cholesterol. The LDL, the cholesterol that causes plaques. There's actually something called good cholesterol, which you want to be high because it clears out that bad cholesterol. HDL. So when you take fish oil, 4,000 milligrams daily, you increase those HDL levels, which decrease the LDL levels. Another one, lecithin, okay? There are 2 sources of lecithin. You can get soy-based lecithin or sunflower lecithin. Soy-based lecithin is better for women because, especially if you're perimenopausal, menopausal, because you get that estrogen effect, exactly. Yeah. Sunflower lecithin, best for men because you don't want to grow boobs, right? So 2,000 milligrams of lecithin every day. Those all will help to get your cholesterol down. Then you got to do the hard work too. You got to do that exercise in the gym, getting that heart rate up, burning 5, 10, 15 pounds of fat will get the cholesterol down. I will say, I got my cholesterol down from it was like 250 something, 253, down to like 170, strictly with diet, exercise, lecithin, cinnamon, fish oil, and watching what I eat.
And I was going to say, you forgot one big part of it. And it's something that people don't think about a lot. This is my other thing. Other than EDCs, the other drum that I like to beat, fiber. fiber.
Yes.
So you have got to see. There's so many easy ways to bring your cholesterol down without medications. You just need to eat a well-balanced. Not saying that you don't, but I'm saying just in general, we all need to eat a well-balanced diet, and that means lots of fiber. Because what people don't realize is when you eat fiber, people think, oh, fiber keeps you regular, helps you have a regular bowel movement. It definitely does that. But fiber is something that when it gets down into your gut, because what happens when your cholesterol is high? A lot of times it's you're absorbing the fat from the food across the gut into the bloodstream, and then it's circulating around in the bloodstream, making plaques in the blood vessels, blocking blood supply to the heart, blocking blood supply to the brain, causing heart attack, causing stroke. However, you can stop it from getting into the bloodstream altogether by eating fiber, because what happens is fiber kind of like just mixes with that fat when it's in the gut, and it prevents your body from absorbing it. So eat lots of lean, I was going to say lean meats. I mean, lean meats do have some fiber too, but actually you want to eat lots of fruits and veggies, exactly, and legumes, so like beans. And if you eat a lot of green leafy vegetables, a lot of fruit, a lot of legumes, you're getting that fiber. You can also do fiber supplements, chia seeds. That's a big one. So I make a little shake every day and I put my fruits and veggies in there, and then I put a ton of chia seeds in there. And that will help bring that cholesterol down like tremendously. And it doesn't just slow the absorption of cholesterol from the gut into the bloodstream, it slows the absorption of sugar as well.
I was going to say, so it's good for cholesterol and blood sugar.
Yeah, so if you want to get rid, it's a triad of things that's killing us. High cholesterol, high blood sugar, and high blood pressure. You can get rid of two of the legs of that triad by just doing a lot of fiber. Lower cholesterol, lower blood sugar.
So summarize it: diet, exercise, weight loss, cinnamon, fish oil, lecithin, and fiber. And one last one, if you're really hardcore, niacin. It'll give you hot flashes, but that helps as well.
You get so flushed, like you want to rip your skin off, but it works really well.
But it does help.
And I was just going to say, on our show coming up, which I told you guys before, but I'll tell you again, Second Opinion with the Twin Doctors on Fox32.com and all of their streaming platforms.
September 17th.
September 17th, yeah. But we had a gastroenterologist on there who wrote a book, a New York Times best-selling book, about the benefits of eating fiber. And he actually was a Netflix documentary about this as well. I am telling you guys, do not sleep on the fiber. And this guy, like he said, and you'll see it more in the show, but I'll give you a little preview now. He had this rule, because people always say, well, how do I know how much fruit and veggies I should be eating? And so he had this rule. He said the rule of 32. He said, basically, you want to have 32 different colors per week in your diet. Now, when talking about different colors, different colored fruits and veggies. And if you get 32, or you want to have 32 servings of different colored vegetables per week, not 32 different colors, 32 servings of different colored vegetables per week. And if you do that, you're getting enough fiber. It's going to keep that blood sugar and that blood cholesterol in a healthy range. And then your doctor's going to say, have you been taking my statins? And you're going to say, no, I have not. And why didn't you tell me about the fiber? And then you're going to say, thank God the Twin Doctors.
And fiber is a good prebiotic. Okay, all righty. So next one, Melanie.
Sorry, I was just on call.
Melanie asked, will this be recorded? I just joined, but want to watch the full video? Do that, Melanie. And it will be recorded.
It's going to be saved on our socials. So it'll be saved on the Twin Doctors, and it'll be saved on BDO as well.
Exactly. Okay, can you curb sugar cravings with probiotics? Okay, that is a great question.
Man.
That is good.
Probiotics, I love them.
Let me tell you. So it's not just
take a step back. So I just want to tell you guys something. I don't think people realize we're more bacteria than we are human. There are actually more bacterial cells in and on our body than there are human cells. We are composed of bacteria.
Yes.
And we have good bacteria and we have bad bacteria.
Exactly. And so it's not just about probiotics. Probiotics are kind of like the end result, right? It's about prebiotics and probiotics, okay? So did I say probiotics and probiotics?
No, you said
prebiotics and probiotics. So prebiotics are things that you eat that help the good bacteria to grow in your gut. Probiotics are those good bacteria that you're putting into your gut.
Exactly.
So it's about prebiotics and probiotics. And this is the thing, much like us, bacteria are hungry, right? Yes. And so if you put the good bacteria in your gut, they will help to...
No, if you put the prebiotics in your gut.
The good bacteria. Well, the
probiotics are the good bacteria.
I know, but you can take probiotics too.
No, I know, but okay, go ahead.
Anyway, whatever. You know what we're saying. If you eat prebiotics and take probiotics, so you're populating your gut with those good bacteria.
That's the probiotics. The probiotics are the pills you take to put the good bacteria in there, but then you don't want to starve them, so you give them the prebiotics. That's the food for the good bacteria.
And so what that will do is it will keep you regular, of course, but again, it helps with that sugar metabolism, because when you're hungry, that's your body's way of saying it needs something, right? Yeah. And generally it needs some glucose, but also it could mean that you're thirsty. A lot of times people mistake dehydration and not having adequate water intake for hunger. So that's why people lose weight when they actually drink more water. So if you find that you're always craving something, if you're hungry, if you're craving sugar, drink more water, that'll help. But yes, take probiotics, you can get those over the counter, but also eat those foods with prebiotics, and you will find that will do wonders for your sugar levels, sugar metabolism, and for your hunger. Go ahead.
The foods with prebiotics, again, oftentimes it's going to be fiber-rich fruits and vegetables. The healthy bacteria love the fiber-rich fruits and vegetables. So not only are you preventing your body from absorbing fat and sugar when you eat fiber, you're also feeding the good bacteria in your gut. And I'm going to tell you guys, like probiotics, like you hear people talk about probiotics from the standpoint of
the gut. It's
the
about
gut
more than
and GI
that,
regularity.
more than
Guys,
that.
I am telling you, like, this is something, again, and I'm not pushing it, but I am pushing it. But honestly, the guy that we've filmed 10 episodes, they were all super interesting. But this was one of the episodes that I think I found myself walking away from the most, thinking like, my God, I want to change my life. People don't realize the gut the bacteria in our gut control everything. So for example, did you know that you have more immune cells in your gut than you do everywhere else? So when you have a healthy gut microbiome, meaning you have a healthy balance of good bacteria in your gut, that determines how your immune system functions.
Yes.
So eating prebiotics boosts your immune system. Not only that, what ends up happening when you don't have a healthy balance of good bacteria in your gut, you get something called leaky gut. And so what that basically means is this. So you've got the bacteria in your gut. Now, let's say you're not feeding them what they want. What do they want? They want fiber. You're not eating a lot of fruit. You're not eating a lot of veggies. You're not feeding them. The bacteria in your gut are like, well, I'm here now, so I'm eating. So guess what I'm going to eat? I'm going to eat the lining of your gut.
Yep.
That's what leaky gut is. So literally, these bacteria are like, you're not feeding me what I want. You're eating all this crap, but I want fruit. I want veggies. I want fiber. You're not feeding me. I'm going to start to eat the lining of your gut. Now, the lining of your gut, which is a barrier to protect you, has been compromised. So all of these toxins cross from your gut into your bloodstream. That's what they call leaky gut. And then once you've got leaky gut, you've got these toxins in your bloodstream. Your body's like, these do not belong here. I'm mounting an inflammatory response. What people don't realize is this: inflammation may start in the gut, but inflammation goes everywhere.
The brain.
Yes.
And that is why people, when they have good gut health and they take probiotics, they have less heart disease, less dementia, less stroke,
diabetes,
less
everything.
diabetes.
Because I'm going to tell you, if you had to fix one thing in your life to be generally healthy, I would say you want to reduce inflammation. Inflammation is what
kills. Inflammation is literally what kills.
It's literally what kills you. It's what jacks everything up. And so if you have a healthy gut microbiome, you're not going to have a leaky gut. You're not going to have toxins leaking from your gut into your bloodstream. You're not going to have generalized inflammation trying to react to these toxins. You're not going to have generalized inflammation. You're going to be an overall healthier person. So get probiotics, GI probiotics, but also eat the prebiotics. And that's basically going to be lots of fruits, veggies, fibers, whole grains, things like that. Yeah.
All right, so this is actually a really good question. And this is a quick answer. So don't make it 5 minutes, Dr. J.
No, but we want to break it down.
I'm kidding.
We want to break it down.
I'm joking. He just likes to talk. Okay. Hi, doctors. This is from my Sammy Joe Fitness. If that's really your last name, I like it. Okay. Hi, doctors. What do you suggest for a teenager with extreme cramping besides birth control pills? Okay. So a lot of times when you go to a doctor and say, my daughter's having a really bad cramp.
I'm sorry, I'm on call. They keep messaging me. I told them, literally.
They're going to say birth control pills. Now, it's not that birth control pills are the wrong answer, but what causes the cramping? Anybody that's had a baby knows the uterus is by and large a big muscle. And so just like the muscle contractions cause pain when you're in labor, that's what's causing cramping when you're having your periods. And what causes those muscles to contract? A hormone called prostaglandins. So what you want to do is you want to reduce the production of those prostaglandins. And there's a very easy way to do that. NSAIDs, but a particular one called naproxen. What you want to do is get an app, time your period so that you know when your period is going to come. You take 1 naproxen in the morning, 1 naproxen in the evening, for the 5 days leading up to the start of the period, plus the first 2 days of the period. So for those 7 days. So once in the morning, once in the evening, starting 5 days before the period starts, every day through the second day of the period, 7 days total. Less bleeding, less cramping, absolutely does wonders.
You, sir, are a pharmaceutical shell.
And magnesium, magnesium. Let me finish.
Yeah,
and magnesium. So again, what is it?
Not only magnesium, I was going to say turmeric. So
can I finish my magnesium thing
okay,
first?
Go ahead.
So basically, again, we're talking about the muscles of the uterus, right? Magnesium relaxes muscles. So that's why it'll help you get a good night's sleep as well. So naproxen, magnesium, turmeric. Go ahead.
Turmeric, yeah, because again, what he said basically is when you're getting cramps, he said it was going to make it fast. He didn't make it that fast. But
that was kind of fast.
Anyway, when you're getting cramps, it's because your body's responding to something called prostaglandins, right? And prostaglandins are part of the inflammation response, right? And so you want to take NSAIDs, like you said, non-steroidal anti-inflammatories, because it stops inflammation. Prostaglandins are no longer produced. That gets rid of the cramping. But that's, like you said, naproxen, Motrin, aspirin, things like that. But there are natural, for lack of better terms, NSAIDs, natural things you can take to prevent inflammation. One, like you said, is magnesium. Another one is turmeric. And when you take the turmeric, you want to mix it with black pepper. Mm-hmm. Sounds crazy. And again, this is what I put in my shake. I should put my shake. I should actually, in the comments, I think I'm going to put the ingredients I put in my shake. But anyway, I put turmeric in my shake.
Inflamed tendons.
I know. My tendons are popping like I'm old. But anyway, but no, you put turmeric and black pepper together, put it in a little, whatever you want, you put it in water, whatever it is, and you drink it, natural anti-inflammatory.
All right, so I hope that helps, Sammy Joe Fitness. All right, so Melissa Carey asked, hey, twin doctors, I'm a candidate for heart bypass. Should I seek a black cardiologist? So far I have seen white and Asian doctors. So let me tell you this. Okay, so from a medical perspective, white, black, green, yellow, it doesn't really matter, right? The reason that I like taking care of patients of color and the reason that I seek physicians of color myself, it's not for the medical knowledge, right? Because for the most part, we all have the same medical knowledge. A big part of the doctor-patient relationship is the relationship part.
Yes.
It is understanding them, understanding you, you understanding them. And so that is why I tend to seek physicians of color, because I think, it's funny. Like when I see a patient that looks like my mom or that reminds me of my grandma, I think of my mom and my grandma, right?
Yeah.
And it's not that I don't take as good a care of people that don't remind me of my mom and my grandma, but the fact that they remind me of my mom and my grandma, I see the humanity in them. They're not just another number. They're not just my 845 patient, right? And so I always recommend seeing a doctor of color. Again, not because of the medical knowledge, but because of that relationship part of the doctor-patient relationship. That's my 2 cents.
But can I also go a step further? Like you said, it is a relationship. And I truly believe that the mind plays a large role in the healing process.
Yeah.
Like they've done research on this, right? And so I think that when you feel comfortable with your provider, when you feel heard, when you feel like you have agency over the process, you view it differently. And your mind can do it. Like we hear about the placebo effect all of the time. That's where your mind literally prevents you from feeling pain. Like the mind is incredibly powerful. And so when you have that good relationship with your provider, your mind is able to put you in a place where you can have better results. That being said, you want to choose the best doctor first and foremost. But if they're all equal, then yeah, that's a very valid secondary consideration.
Yeah. All right. And good luck with that. And
we're praying for you, truly.
Absolutely. Okay, so Melissa said, okay, and my daughter wanted me to ask if sugar alternatives are better than raw sugar cane for everyday tea.
Everyday tea?
Everyday tea, yeah.
Oh, no, unfortunately, they're not. And this is coming from a self-avowed
I was going to say, he's a shill for the Splenda company.
Yeah, well, no, I don't shill it, but I use it. Like I hate to take us, but I put 7 Splenda in my coffee a day and I have 2 garbage. So you can do the math. But no, so the short answer is sugar in and of itself is not unhealthy. No, sugar has gotten a really bad rep. Anything can be overdone, but sugar in and of itself is not unhealthy. But the sugar alternatives, unfortunately, are. They have a lot of chemicals in them that have been proven to be teratogenic, meaning that they can cause birth defects. Not no kids are taking Splenda, and pregnant women probably aren't overdoing the Splenda, but they can be teratogenic or cause birth defects. They've also been linked with being carcinogenic, so they can be cancer-causing agents. And now, at the end of the day, it's about the dose, right? So if you take 1 Splenda a day, is it going to harm you? Probably not. But everybody's body is different. Everybody responds differently. So I guess short or long answer to a short question is sugar is better.
And the sugar alternatives also increase inflammation. And like we were talking about earlier, inflammation is the killer. And I'll give you a little anecdote. A while back, I got on this health kick. I thought it was a health kick. I was trying to lose weight, and I started drinking. I'm not gonna name and shame the name of the company, but it was one of those companies where you can get put like flavor in your water basically to make it tolerable. Whatever. And I was drinking that like all the time. I had 7, 8 bottles of water a day, and each one had one of those packets.
This dude grew a tail.
I swear,
he grew a tail.
Why you gonna tell me my tail? No, honestly, it's crazy as it sounds, and it's TMI, but I could feel my bladder. I can feel my bladder. I'm not supposed to feel my bladder, right? I can feel my bladder. And I think that all that aspartame was irritating my bladder. So it causes inflammation. Raw sugar is much better for you.
Now, if you don't want to do sugar, there's monk fruit. Monk fruit is a healthy alternative, plant-based. There's stevia, healthy alternative, plant-based. But we're not going to say that. We already said it. Splenda equal, sweet and low and sweet, whatever you want to call it. Not something you want to be doing.
All right, so let's see. Okay, can you help me with Graves' disease? I'm 32 and feel horrible. Okay, so Graves.
I was going to say, let's tell people what Graves' disease is first. So Graves' disease is okay. Let's take a step back. We all have what's called the thyroid gland. Thyroid gland is a gland in our neck,
but it regulates our metabolism.
I was about to say it's located in our neck, but it affects everything. So thyroid hormone is like fuel for the body. So every cell in your body, from your head to your toe, uses thyroid hormone to keep the lights on, basically. And so when your thyroid gland is overactive, you're producing too much fuel and you're just like, it's like you're overly energized. And when your thyroid gland is underactive, you're starved of fuel. And so everything becomes sluggish. You don't think as quickly. Your blood pressure is lower. Your energy levels are lower. Your metabolism is slower. So you tend to gain weight. Graves' disease is a condition where you get autoimmune attack of the thyroid gland.
So you get antibodies that basically stimulate the thyroid.
The thyroid gland becomes overactive. You become hyperthyroid. You're producing too much of that fuel. And then eventually, not always, but eventually the thyroid gland gets burned out. And then you become hypothyroid. So that's what Graves' disease is.
And this is the key when it comes to Graves' disease. Assuming you aren't already, you want to see an endocrinologist, a doctor that specializes in hormones, because you need to be following your thyroid levels very closely, at least every 6 months, or usually every 3 to 6 months. And so a lot of times when you start to feel not great, be it that you, like Dr. J was saying, you feel overly agitated or you feel very slow and constipated, things like that, it means that your thyroid levels aren't where they need to be and your medications need to be adjusted. So,
and anytime, and just as a general rule, anytime something's affecting all parts of your body, like I'm constipated, I can't sleep, my weight, just stuff that doesn't seem like it's related, think about your thyroid.
yes.
Because when your thyroid gland is off, everything's affected. So when you just have this collection of symptoms that feel like they don't add up.
Hair, like people lose the hair loss, their nails get thin.
I was going to say, let's just go through it quickly.
They have diarrhea, they have constipation.
I was going to say, let's just quickly go through the symptoms. So basically when you're hyperthyroid, you tend to lose weight unexpectedly. You're like, this is great, but
you feel really anxious, you feel jittery, you have headaches, your blood pressure's high.
Sweaty, you can't sleep, you have diarrhea. On the flip side, when your thyroid gland is underactive, you tend to gain weight because your metabolism is slow.
You lose hair, your nails thin.
You lose hair, your nails thin, your skin is dry.
Constipation.
Instead of diarrhea, constipation. Yeah.
Okay, let's see. My aunt wanted me to ask how effective Paxlovid is for fighting COVID symptoms. So Paxlovid is a medication that you really want to take early on. So Paxlovid is quite effective. Everybody responds differently. It's quite effective, but it's really only effective if you take it early on. So
I normally say within the first 24 to 48 hours, if you can.
I know some folks that are day 5, day 6, day 7 that ask for Paxlovid. I'll prescribe it, right? It's not going to hurt you, but it's not going to be nearly as effective. So as soon as you're diagnosed with COVID, you want to take that Paxlovid. People want to wait until the symptoms get really bad, but at that point, it's kind of too late. As soon as you're diagnosed, if you're a candidate for it, just take it as soon as you're diagnosed, within the first 24, 48, 72 hours max.
Also, lots of zinc, lots of vitamin C, lots of echinacea. Anytime you have any viral respiratory thing going on, COVID, flu, cold, whatever the case may be, vitamin C, zinc, echinacea, they really boost that immune system. Paxlovid for COVID, Tamiflu for flu, things like that.
Yes. All right. Let's see. She said, okay. My mom was wondering if perfumes and fragrances are safe for her skin.
Well, so perfumes and fragrances aren't safe, period. To be honest with you. Having said that, I just put on some cologne when I took a shower today. So, I understand
living
people
dangerously.
I'm living on the edge, man. No, but so I, we can give you this advice, but we all know it's tough. We struggle with it ourselves. But again, we were talking earlier about EDCs, endocrine disrupting chemicals. Unfortunately, anything that's got fragrance in it, be it a soap, be it a lotion, be it a fabric detergent, be it perfume, cologne, pretty much anything that's got fragrance is going to have EDCs, endocrine disrupting chemicals. Endocrine disrupting chemicals affect your endocrine system, like we said, basically your production of hormones. Hormones, just so people know, and when people think of hormones, they think like, hormones, right? Or that too. But no, hormones are basically protein signals that allow your body to communicate. So your brain communicates with your heart, communicates with your gut, communicates with your skin through these messaging signals, right? And so when your hormone system is out of whack, parts of the body can't talk to one another, and it's problematic. So that can be very bad for the skin because both you can just get local irritation, but then also other parts of your body like your immune system that have to talk to your skin because your skin is actually your body's largest immune organ. People don't realize that, but if you think about it, it's your barrier against the world. So your skin is your largest immune organ. When you're exposed to these EDCs, your immune system and skin can't communicate properly. It can result in local inflammation, local irritation, and things like that. But it can also result in body-wide immune issues. And so long and short of it is, ideally, you want to avoid fragrances.
But couple of options. If you do want to use perfume, put it on your clothes. Don't put it directly on your skin. And then essential oils. Those are 2 good options. Because
But ideally, plant-based essential oils. People don't realize a lot of essential oils are chemical based.
Yes.
So plant-based essential oils. And I have nothing to do with the app. So believe me, I'm not plugging anything. I just use it, and I want to let you guys know what I use. You can look, but I'm going to tell you there's an app. It's called it's the Environmental EWG app. That's what it is. So it's an app put out by the Environmental Working Group. The app is called EWG Healthy Living. Hell, I'll show you guys. This is what it looks like when you go on the app, right? So my privacy screen, maybe you can't see it. But basically, so this is an amazing app. Basically, any food, any healthcare product, any home product, I mean, anything you can think of. You basically go to this app, they got a little button, you can scan the barcode, and it will tell you if it's got endocrine disrupting chemicals, if it's organic, if it's inorganic, if it's got carcinogenic, cancer-causing chemicals, if it's got teratogenic, birth defect-causing chemicals. And you can use this literally when you go to any store buying anything, even your sheets. Because, you know, like a lot of fabrics have stuff in it that you don't want. You get this app, you download it. I swear to God, I am not paid anything by these people. I just use it in my real life. And it will direct you, and you will know like what lotions and perfumes and soaps and detergents are and aren't safe.
Okay, the next question. So, Alexandro Devante is asking, he said, I was visiting my grandfather and the nurse told me that he was a sundown patient. What does that mean?
So basically, sundowning is something that you see in patients typically who have dementia, but it can be really anybody who's confused. Like there's also this entity that we see in the hospital called ICU psychosis. Pretty much, believe it or not, guys, like our human brain is so delicate. Like if we don't see sunlight, we quickly become confused, right? And so anybody who's not able to see the sun, be it that they're in the ICU, so they're in an area where there's no window, so they don't know if it's day or night, or people who have dementia start to exhibit what's called sundowning, where basically they become confused. They don't know necessarily when it is or where they are. No, I was going to say, so I mean, one thing, and I don't know, my assumption would be maybe he's in a care facility since you said you were visiting him, but maybe not. But one thing, if at all possible, if you're caring for him or if you can talk to people who are caring for him, just encourage that, assuming you're in a climate where it's possible, take him outside, maybe for 30 minutes a day, for an hour a day. If you can't go outside, sounds crazy, but put him in front of a window. Just as soon as
happy light.
Or a happy light, but yeah, that too. But just when sunlight or UVA and UVB rays hit the retinas, hit the eyes, they send a signal to the brain, which causes the production of serotonin. That's how we know it's daytime. And then when serotonin levels wane, melatonin levels increase, and we know it's nighttime. And so that serotonin, melatonin fluctuation is super important for us to not only stay healthy, but to know who and what we are and where we are.
Yes. All right. So I think it's Ian Johnson Holloway is asking, is sea moss good for you? If yes, tell me more. Okay. So I think it's one of those things that you hear a lot about. And yes, sea moss is actually quite good. Okay. So a couple of things. Sea moss is really good for digestive health. So we were talking earlier about fibers and we're talking about those prebiotics, fiber, and about the prebiotics. Sea moss helps with digestion. It helps with relieving bloating for some folks that are taking fibers. It helps with constipation. So in that sense, it's very good.
And it's an antioxidant.
Well, I was getting to that, but go ahead.
I was going to say it's an antioxidant. So here's a little trick. You remember I was telling you guys earlier about you want to make sure you have 32 servings a week of like colorful fruits and veggies. The more colorful a fruit or a veggie is, the more richer it is in antioxidants.
Exactly.
And just so you guys know what are because people always throw around these terms.
So antioxidants, basically, they reduce inflammation, right? And so, like we were saying earlier, inflammation is probably, I would say, if I had to pick one health issue, it's the one, right? It leads to pain. It leads to, pain syndromes like arthritis. It leads to migraines. It leads to heart attack. It is kind of the root cause, cavities, everything. It is the root cause for all kinds of things. And so that's why it's so important to have antioxidants. Like Dr. J was saying, you always hear these terms like antioxidants. If I could make one recommendation, it is treating the inflammation, and antioxidants are key in doing that.
So sea moss, or anything that's really green, really red, really purple, like what's the dollar? Eggplant. Eggplant. Yes, I was going to say zucchini, but they're green. Eggplant. Anything that's very colorful is rich in antioxidants. And like you said, basically, just so you guys know, like every day our body, when it's working properly, actually creates what's called oxidative stress. One thing that happens when our body is just going through its daily metabolism.
Which is what causes inflammation.
Yeah, when it's going through its daily metabolism, it creates something that's called oxidative stress. That's normal, but oxidative stress is what beats your cells up over time. So how do you counteract oxidative stress? Antioxidants.
Exactly.
And so that's what antioxidants are. They basically get rid of the toxins that our body makes normally. Think of it like this. When you see a car driving by, you see that exhaust coming out of the back, that's normal. That exhaust has to be produced, but it's not good for the environment, right? Well, when our body's doing what it normally does, it creates oxidative stress and metabolic byproducts. That's what's supposed to happen. But overall, that's why we age. It's not good for us. It starts to beat our body up after a while. But if you take antioxidant, get rid of the oxidative stress, you overcome the production of those toxic metabolic byproducts.
And sea moss also has a lot of iodine, which is good for thyroid health, right? Full circle. We're
We
talking about
divided wrong.
thyroid before, hypo and hyperthyroidism. It's good for thyroid health. It's good for immune function. It's good for heart health. So yes, sea moss, you read a lot of things, you hear about a lot of things, but sea moss is one of those trends that I would absolutely recommend.
You
Absolutely.
look like you got sea moss growing out of your ears.
Hey,
Man. Trim those
it's good.
things.
I know.
Trim
Okay,
those
I know he's not trying to
things.
call me out. Can I please get the camera and bring it over here, man? I know you did not. Okay, all right. So, all right, let's see. A friend of mine is 21. She did the Depo shot for 2 years and don't laugh at him. He's not funny. And got off of it. She had normal periods before, but the shot stopped her periods. Her TSH has been going from the normal range to the low normal range and up and down. And her T3 and T4, these are thyroid hormones, have been erratic as well. Thyroid ultrasound has been normal. Okay, so this is the thing. So we're talking about two things here. So let's talk about that Depo-Provera shot first. Depo-Provera is a great form of birth control, right? Okay, but what happens, and it's idiosyncratic. Everybody responds to it differently, right? So some folks will be on Depo for years and years and years and years, and they stop, period comes back. Some folks will get one Depo shot, and it can take up to 18 months for your periods to return.
And that's considered normal.
And that's normal.
That's considered normal.
That is considered normal. So I tell people, if you're looking for a good long-term birth control and you're not going to want to get off and conceive right away, Depo's great. Every 3 months, you don't have to think about it. Good, you know? But yes, when you have Depo, you may not get your period for up to 18 months. Having said that, it's never a bad idea to go get worked up. And so her doctor did the right thing. If somebody's having what they call amenorrhea, they're not having their periods, you want to check their hormones. We talked about it earlier, all those PCOS hormones. You want to check the thyroid hormones as well. You said her thyroid ultrasound was normal, so that's good. And they're asking if this could be affecting her period. So honestly, I think in this situation, and we would need to see more labs, check for PCOS, all those other things, prolactin, a bunch of labs. But I think in this situation, it's more related to the Depo. Now, what can you do? Either A, you can wait, period will come eventually, it can be 18 months, but it will come. Or you can do what they call an estrogen challenge. The reason you don't get your period when you're on Depo-Provera is progesterone is that hormone that thins out the lining of the uterus. So I tell patients all the time, they're like, is it unhealthy to not have a period? I say, when it's because of Depo, it's not. You don't have a period because there's nothing to come out. Estrogen does the opposite. It builds the lining of your uterus back up. So if the period hasn't come and you want to get that jump started, do an estrogen challenge. They can give you a prescription for estrogen. That'll build the lining back up. Then they'll give you some progesterone, thin it out, and then your period should resume. But long story short, I think it's a Depo. Not having a period for up to 18 months is normal after Depo. Do get a workup if that happens. Make sure there's not something else going on. And if you want that period to return, an estrogen challenge should do the trick.
And I imagine while you're looking at the next question, I'm just going to say people are probably coming in and out. So for you guys who are just joining late, you guys probably hopefully you know who we are, but we're the Twin Doctors, Dr. J, Dr. I. We used to do BDO for years, and now we're coming back. And we just want to encourage you guys to please show us a little bit of love, because we don't feel love. No, show us a little bit of love. Please follow us on our socials. We're the Twin Doctors _ on Instagram, the Twin Doctors Official on Facebook. We got a TikTok. We haven't started dancing yet. I've seen some other Twin Doctors dance.
I can dance like last 2 weeks ago, actually.
Okay, we'll even dance on our TikTok, you know. And please follow us on our show that's going to be airing soon on the 17th. You can find it on fox32.com and all of the Fox 32 local streaming platforms like Hulu and all of that stuff.
So this next question is actually a very good one. They've all been good ones. So, but this one is
actually have been like
they really have been.
And this is what I love about when we used to do the BDO. We would get some great questions. You see, we get excited because like I feel like we're almost like gatekeepers. We have this knowledge, and we feel like a lot of times people don't want it. So when people want it and we can give it to them, it's exciting.
Sorry, the clock is ticking. So this one is really important. So Gloria Williams, she said Twin Docs. So she's talking to me, not you. She said docs. It's just me. Dark lines on toenails. Okay.
Oh,
so this is really important. Okay. So when people,
but not just toenails, any nail.
And I'm gonna. This is gonna be a show and tell moment, because I'm gonna show you. No, seriously, I've got them. I don't know if you can really see it. I'm gonna come close and see. You see over in the corner of my this doggone thing. You can kind of see. Yeah, you can see on the corner of my nail right here. That's not dirt. That's what they call melanonychia, right? Melanocytes. Those are the cells that make melanin. That's what gives us our color, right? But sometimes you can get what they call a melanonychia, which is where it is in the nails. It can be fingernails, toenails. I've got a more pronounced one here. I've got a few on my fingers. So a lot of times it's not a big deal. But it can be a sign of melanoma, which is a form of skin cancer. So if you have a melanonychia, don't freak out. You're going to probably live. You're going to be fine. I've got a bunch of them. But do see your doctor, because it can be a sign of melanoma, which a lot of folks don't think about in Black folks.
Yeah. But also it can sometimes be a sign of iron deficiency as well. So when you notice discoloration of the nails, or if you notice nicking where it looks like there's little indentations in the nails, almost like somebody was digging into them, that can be a sign of iron deficiency as well.
Okay. All right. Let's see. Bridget Elaine asked, if a person whose body doesn't make cortisol, what is the best thing? Put on my emergency bracelet that an EMS would understand and know what to do?
I would just,
I mean, honestly, that's
so
a
just
good
take a
question.
step back, guys. So first of all, cortisol is a hormone that's produced by the adrenal glands. So we have these little glands on the top of our kidneys that make cortisol. Cortisol, you
It's
hear
a
it,
stress hormone.
they call it the stress
stress
hormone, right? So cortisol basically kicks in, like if we're in a stressful situation, cortisol is what helps our heart rate go up, our blood pressure go up, our pupils dilate so that we can kind of have that fight or flight situation, right?
Yes.
But you only need it in short doses. Like when you have chronic exposure to cortisol, then it can actually be bad for you because you're like constantly in this fight or flight mode, right? So that's what cortisol is. Now the question was,
so basically, she's got a cortisol deficiency. She doesn't produce cortisol, and so she's asking what would be a good thing to put on a bracelet, like an emergency bracelet, so that EMS knows. And honestly, I don't know if there's a shorthand way to put it. I would just probably put like cortisol deficient.
Yeah, I was gonna say that, or put like adrenal disorder, or adrenal fatigue, but it's not even really adrenal fatigue.
Yeah.
So I would just say,
I think I would just say cortisol deficient. I honestly think I would.
Or it depends. If you don't have an adrenal gland, I'd even say like no adrenal gland.
I guess that's the question. You don't have to answer. But if it's because you don't have an adrenal gland, then I would just say no adrenal gland. If you do have an adrenal gland and you're just not making cortisol, I would say cortisol deficient, because yes, that is very important for any healthcare provider to know. So I would say cortisol deficient or does not have an adrenal gland, but something that's easy to understand and they don't have to like think too much about it. Yeah. Okay. So Michael Darrell Anderson said, thanks for the invite, Twin Doctors. Thanks for coming,
Thanks
Michael.
for coming. Honestly, we appreciate it. Like we haven't been on BDO in so long. We love the love. Thank you, guys.
All right. So Melissa Carey, hi, Twin Doctors. I've been really into fragrance layering recently, where you have to wear multiple lotions, then oils, then add mists, perfumes to make a signature scent.
Wow.
Is it okay to have all those chemicals on your skin? All right, Melissa. Yeah. So the fact you're asking this question means you kind of know the answer already.
What movie was that?
No, that was Locked Up Abroad.
Locked Up Abroad.
Locked Up Abroad. Yeah.
Anyway,
but yeah, like we were talking about earlier, a lot of these fragrances have these EDCs, endocrine disrupting chemicals. And like, listen, I like to look good. I like to smell good. I'm gonna put my fragrances on, but you want to use it sparingly. Don't put it directly on your skin, ideally,
But she was saying the fragrance layering. So maybe what you're getting at as well is...
Well, she's saying using multiple.
Yeah, but so one thing you can do, and I'll be honest with you, I haven't heard the term fragrance layering, but I think maybe I do it, so I think I know what you're talking about. So are you putting the fragrances...
She said wear multiple lotions, then oils, then mists, and perfumes.
But are you wearing the multiple lotions to kind of to create a barrier between your skin and the fragrance, I guess is my question. Because if you are, that's actually a very smart approach, because you're not having the fragrance directly...
He gave you credit I didn't give you.
Yeah,
okay, go ahead.
So you're not having the fragrance directly touch the skin. So I kind of do that actually, guys. One day I'm gonna sit down and tell all my little tricks. But so what I do is I make my own lotion. I make my own. I make my own lotion because again, a lot of these lotions are not good for you. And I use two things. I use beef tallow and I use shea butter, right? And I can explain why, but it doesn't matter. But that's what I use. So anyway, that creates a nice thick layer on the skin. And then after that, I will, if I'm going to put on not essential oils, but if I put on my Egyptian musk or I put on my colognes, I'll put it on afterwards. And because they're fairly thick, good for the skin, a lot of reasons why I could tell you later, but it also does protect the skin from getting that direct contact. So maybe that's what she's referring to. And if you are going to do the lotions, if you are going to do the chemical fragrances in particular, putting something like shea butter, beef tallow, coconut oil on first, and then that on top, that's an excellent approach. You need to give her credit.
No, I just assume she's putting on but you're right. If she's layering like that, putting on a protective barrier, way to go. If you're not, shame on you. No, I'm kidding. All right, okay. All right, so Kristen Vaughn Robinson said, Dr. J, we want to see your dance moves. She didn't say Dr. J. All right. So, okay, you go. No, I don't have any. I'll be honest, I don't have any. Well, I was gonna say, what was the rerun dance like that?
Oh yeah, yeah. Sadly, we don't have. That's why we're not the Twin Docs.
You don't want to take it to the club.
Yeah. You don't take it to the club. We're not the Twin Docs.
We're the DDs. We're the designated drivers.
Exactly, designated drivers. We did the Ancestry.com. We're like 27% white. I think we got.
It was 29.
29%
It's
white.
all my dancing
I was going to
genes.
say 71% African. That 29% white is all in our dancing genes, I guess. Man.
All right. Melissa Carey said, ooh, thanks.
She's like,
then she gave the bomb. No, she did. I'm just adding that in. Okay. All right. Well, it is 3:59. So I think they're going to turn us off at 4 o'clock, I think.
Okay.
So,
are they? Well, I guess
I'm assuming so. I don't know.
Well, check this
out.
guys.
Please follow us on our socials, the Twin Doctors on Facebook, Instagram.
Well, no, Instagram is the Twin Doctors _.
Yeah. The Twin Doctors _ and please,
Facebook
please.
is the Twin Doctors official, right? I think it's the Twin
Doctors.
Doctors.
The Twin Doctors, you'll see our face. That's us.
Yeah. And then Twitter, we have to make a new Twitter. It's the Twin Docs. Yeah. And then we have our TikTok, which is
I think it's the
Twin Doctors.
Yeah. And please like us on all of our socials. Please like BDO. Please follow us. Please follow BDO. And please remember, on the 17th of September.
And
Second Opinion with the Twin Doctors. And
every-
like it.
Every Monday thereafter.
Monday.
It premieres on the 17th, but every Monday, 7 p.m. Central, fox32.com. But then if you just Google fox32.com, you'll see they have links to their website, to their YouTube, all of their platforms like Hulu and things like that. You guys can watch it. And please, it's super important because A, we love to give you guys knowledge. B, corporate medicine profits off of making you sick.
Yep.
But the reality is that there is so much joy in us helping you to stay well. And we love doing that. So please support the show. And hey, at the end of the day, it is nice to see people sometimes who look like you.
All right, I'm Dr. I.
I'm Dr. J. We are the Twin Doctors, and this has been Catching Up with you guys.
And we're coming back, baby.
We're kind of
coming
doing this
back.
every week. So please, we'll see you guys real soon, okay?
Should I dance him out? Dance him out. Dance him out.
Hey guys, I'm Dr. J.
I'm Dr. I, and this is Second Opinion with the Twin Doctors.
Can somebody give me two of these, making money, make money.
I heard that.
Can somebody give me two of these, making money, making money.
Can somebody give me two of these, making money, making money.
Hey, can somebody, hey, give me,
This appointment's almost done, but before you head out, go to the reception desk.
And what? Make your appointment for what? The next episode of Second Opinion with the Twin Doctors. I'm Dr. I.
I'm Dr. J.
me.